Laguna Honda JCC Committee meeting for March 10th, 2025. Mr. Morwitz, will you call the roll?
Sure. I'll start with you, Vice President Guillermo.
Present.
And President Green. Thank you. I will read the land acknowledgement. The San Francisco Health Commission acknowledges that we are on the unceded ancestral homeland of the Ramaytush Ohlone, who were the original inhabitants of the San Francisco Peninsula. As the indigenous stewards of this land and in accordance with their traditions, the Ramaytush Ohlone have never ceded, lost, nor forgotten their responsibilities as the caretakers of this place, as well as for all peoples who reside in their traditional territory. As guests, we recognize that we benefit from living and working on their traditional homeland. We wish to pay our respects by acknowledging the ancestors, elders, and relatives of the Ramaytush Ohlone community and by affirming their sovereign rights as First Peoples. We can move on to item 2, which is the approval of the February 3rd, 2025 committee meeting minutes.
Okay, we have the minutes in front of us and have reviewed them. Is there a motion to approve?
To approve.
Okay, second.
All those in favor?
wait,
Sorry.
good. Public
comment.
yeah.
First, public. Is there any public comment in the room on the minutes? Item 2. I see none in the room. And any hands remotely? Going once, going twice? No hands. So all those in favor?
Aye.
Thank you. Item 3 is general public comment. And is there any in the room? I see no one. Anyone remotely? General public comment. Item 3. I see no. Oh, I'm sorry. There is a hand. Mr. Manette Shaw, are you there?
I am, Mark. Thank you.
Okay. Please go when you are ready. Timer's on.
All right. I do not have prepared remarks, but I want to add to Dr. Palmer's concern that the commission should expedite presenting the ordinance 7722 on the out-of-county discharges as soon as the data is compiled. It should not wait until July to receive a public report on the number of San Franciscans still being discharged out of county because of the slow pace of resuming admissions to Laguna Honda. So please consider scheduling that as quickly as you can. Thank you.
Thank you, Mr. Manette Shaw. I'm glad to hear your voice is sounding like yourself again. Right, that's the only public comment for that item. So we can move on to item 4, the executive team report. And give me a second to pull it up.
Good afternoon, Commissioners. My name is Deltar Sidhu, and I serve as the Nursing Home Administrator and CEO for Laguna Honda Hospital. And I'll be presenting the March Executive Team report. Just want to start with some highlights. As you know, February was a festive month. We had celebrations of Lunar New Year and a Black History Month. So I just want to thank the staff who organized a series of fantastic events. This included lion dancers, blues band concert, and soul train dance party. It was a highlight was the residents with LED poetry slam, residents and staff recited poems and sang songs. This is really an opportunity for us to highlight, again, our activities therapy department. Every month, they put together a calendar of events for each neighborhood and one for Laguna Honda as a whole. These activities are designed to be fun and connecting, and as they are key part of our resident care. Happy New Year and happy Black History Month. And I just want to acknowledge, as you know, by nature, our industry is designed for risk mitigation, looking at all the regulatory issues that we have, and this is kind of highlight of that we come out of that zone and really celebrate our staff and residents. So just wanted to acknowledge that. Next slide. So on respiratory illnesses, thankfully Laguna Honda, we had a mild respiratory illness season. I wanted to thank our infection prevention and control team. They have done a fantastic job making sure we have our practices and policies being followed to keep the residents safe and protected. Our vaccines, we continue to encourage the staff and the residents. And as you can see, our vaccination rates are higher than the general public. And once we are out of the flu season, we will retire this slide. Next slide. To provide an update on the triple room waivers, as you know, we are committed to recertifying the 120 beds that were taken offline as part of the recertification process. I do want to acknowledge that we have been engaged with our CMS partners, and it is an uphill climb. I just want to make sure that we're on the same page. We are in the process of resubmitting the waiver based on the feedback that has been provided to us. Sorry, give me 1 second, I'm sorry. Sure. My pages got swapped, so I don't have the slides in front of me.
Oh,
Yeah, thank you. Somehow I got. So as I was updating on the waiver, as we have heard from our CMS partner, it is an uphill climb, but we continue to work with them and resubmitting the waiver based on the information that we have received from them. We're also looking at any other possibilities at the state level of any pathways to obtaining certification for the 120 beds, but we remain committed to pursuing every avenue. And we'll continue to keeping the community updated on the next steps. Next slide. On the admission, since we resumed admission in July 2024, we have accepted all appropriate referrals for Laguna Honda based on the criteria that's been approved by the Health Commission. I just want to reiterate, we do not have a waiting list at this time. We continue to process all the referrals that we have received. We're also actively reaching out to different care coordination departments throughout the local hospitals in our health network and encouraging them to make referrals for admissions. And we continue to remind everybody about the bed availability that we have. We'll continue to work proactively and collaboratively with San Franciscans who meet the criteria to ensure that we continue to admit the residents as fast as possible. And I also just wanted to touch base. We have admitted 11 residents from St. Anne. We know that St. Anne's was an integral part of the community. And our heart goes out to the families who are losing, whose loved one will be losing their homes. We want to make sure that we support them throughout this transition. So as we committed in the past, we have really engaged with them and making sure that we are making their transition as successful as possible. So to date, we admitted 11 residents from St. Anne's, and more are expected in the coming weeks. We still have about 14 referrals at different stages of the admission process. Some of those do include their RCFE referrals as well. So the residents have joined our memory care, palliative care, and also in a monolingual neighborhood, as well as our general skilled nursing beds. Once again, I just want to reassure that we continue to work with those families to ensure that transition is as smooth as possible so we could minimize their transfer trauma and continue to support them as they transition to Laguna Honda. Next slide. So on the next several slides, you could see these are dedicated to our admissions data. As you see, we have admitted 36 residents in a month of February, which is a significant climb from the 14 in a previous month. Our goal continues to be welcoming new residents. We have a goal of at least minimum of 7 to 10 residents per week, and we did kind of meet that goal in the last few weeks, and we'll do our best to continue making sure that we further improve this process and stay on track, admitting as many residents as possible. So the increase in our admissions is really attributed to several different factors, including educating our community partners to ensure they understand our admissions criteria so the denial rate continues to decline. Also making sure that we're all getting complete referrals and they understand the types of residents that we're able to admit. Because our goal is we want to make sure that we continue to provide safe, quality care to our residents while protecting the facility as well. So we want to make sure we admit the residents who are appropriate. So we look forward to continuing that partnership and strengthening our admissions process, welcoming more residents in need of skilled nursing care in our community. Next slide. So as you can see on this slide, we have made tremendous improvements in the process, and we're making the admissions decision much more quicker through the application process. The graph shows the admissions decision turnaround time over the past 6 weeks. As you can see, the teal bar shows the decision time beginning with receiving an application, regardless whether that was complete or incomplete. And the light blue, dark blue is the one based on a complete referral from the time we receive it. So our team works with referring partners to assist them with completing the applications if they need any assistance. So as we continue to go through this process, we're confident that the data will continue to show a decrease in decision-making time, as well build a strong relationship with our referring partners and support community referrals throughout the admissions process. Please note that the data does not include any pending applications, so the data may change over time as well. Next slide. This is very similar to the last slide. Can you go back one? Yes, so they're very similar. This is very similar. Instead, the time frame from referral to admission instead of decision, as you can see, they're very similar. For admissions coming from the community and other skilled nursing facility, there are often factors outside of our control. For example, an out-of-town family member may ask to postpone an admission date so they can fly out and support. Also, like, for example, with residents coming from St. Anne's, we've been working with families to ensure their transition is smoother. So a lot of times they've been requesting that we hold off until they're able to visit the facility and really make sure that the resident coming in are appropriately supported. So those factors can sometimes increase the time of admissions. But in general, our goal is that we admit the patients within 3 days from the time we receive a referral. Again, I just want to note that the data doesn't include any pending applications here. Next slide. On this slide, you could see the details of our denials. We have, over the past 6 weeks, out of the 76 referrals, we have denied only 6. 3 were either behaviorally too complex, and some of them were not appropriate for SNF level of care. And you could see the denial rate was very low. It was only 8%. And in the past, prior to that, at the end of January, our denial rate was 30%. So as we anticipate this to continue to decrease as we continue to improve the processes and also educating our community partners to ensure that we are aligned with our admission criteria and what the expectations are for the referrals that they're sending us. So this should really continue to go down. Next slide. This is kind of a long standing slide that shows all the admissions since we have resumed back in July of 2024. At the end of February, you can see we received a total of 215 referrals. And of the total referrals, 104 residents were admitted to Laguna Honda. And there's 29 referrals which are in progress at various stages of admissions process. And a total of 48 were denied and 34 were closed or withdrawn. Next slide. And finally, this is our state of the hospital slide. We added a bar graph just to show our end of the month hospital census, so we could really show that we are climbing in our census. In February, as I mentioned earlier, we had a total of 36 new admissions. We had 7 planned discharges, 1 unplanned discharges, and 8 expirations. So we ended a month with 457. We do not normally see an unplanned discharges, but we did have 1 AMA this month. And the resident decided to go back to the facility they came from. We look forward to continue welcoming more San Franciscans to our community and continue to grow our census. Once again, thank you, and we are available for any questions that you may have. Thank you.
Thank you, Diltar. Is there any public comment?
Is there any public comment in the room on this item? I don't see any, and then I know there's one remotely. Okay. 1 second, I have to pull up a slide. Okay. Mr. Manette-Shaw, are you there?
Yeah, I'm going to use my computer.
Okay, and so I'm going to pull up the slide.
What?
Is this the item for the slide?
Yes.
Okay, give me 1 second. Okay, begin, please.
Thank you, Mark.
It's extremely concerning, the executive team report states. On slide number 4, LHH had to resubmit its application to save 120 of its 769 skilled nursing facility, SNF, beds. The 120 beds at risk of permanent loss represent fully 15.6% of LHH's SNF beds. Since LHH provides 30% of all SNF beds in San Francisco, losing those 120 beds permanently will cause grave harm to San Franciscans in need of SNF level of care, who will be disenfranchised and dumped into out-of-county facilities if these beds aren't saved. It's time for a full court press from Director Tsai and Mayor Lurie to intervene and get these beds saved. If they're lost, then LHH's nursing staff must be immediately reduced by a corresponding 15.6%. As no longer required to provide skilled nursing services at Laguna Honda. Director Tsai should use his experience at the Centers for Medicare and Medicaid Services, CMS, to help ensure approval of the 120-bed waiver. As far as this goes, LHH and SFDPH should have been pursuing all along the state of California pathway to obtain a waiver for certification of the 120 beds. Stop waiting for a dual-pronged effort to save these critically needed beds. On a separate issue, as my overhead slide shows, slide number 8, LHH admissions update, touts 104 admissions to LHH since July 2024 after LHH gained Medicare recertification on June 30, 2024. But there's no mention on slide number 8 that slide number 9, state of the hospital, shows that since July 2024 LHH has lost 57 patients from the hospital's census due to discharges, AWOLs, and patient deaths, for a net increase of just 47 patients overall. While the 37 patients LHH asserts were admitted in February is somewhat encouraging, the patient attrition remains worrisome that LHH will continue losing massive Medi-Cal patient revenue reimbursement during the third quarter and perhaps through the end of the fiscal year. The pace of admissions needs to increase rapidly to account for patient attrition. The addition of the end-of-month census data to the State of the Hospital report is a long overdue, but welcome, addition. Unfortunately, it illustrates a math problem on that chart. Adding the January and February 2025 data together reports a total of 50 admissions and 27 fewer residents lost to discharges, deaths, and AWOLs, for a net increase of just 23 patients. But the newly added end-of-month census data shows a change of only 20 patients between the December census of 437 and the 457 census at the end of February. So, there's a math problem that doesn't add up to explain this variance of 3 patients. Thank you.
All right, thank you. We have one more hand up. Give me 1 second. Dr. Palmer?
Hi, this is Dr. Palmer. I submitted a note that I would like to be put in the minutes, but a point of information is the end of month census are patients that are temporarily in the hospital with a bed hold subtracted from the census. Is that the reason there's this discrepancy of 3? And the other thing is, if you can get this out-of-county discharge numbers in time, this will support saving the 120 beds. And we need to have, I agree totally that we need to have all hands on board to save those 120 beds, and the mayor and our state elected representatives need to help us with that. And is there anything the public can do? And thirdly, arbitrary holds on hiring will result in fines, lost revenue, and people dying or being sent out of county. And does the mayor and the new supervisors, are they educated on this? Do they understand how complex the regulatory environment is in a nursing home? Thank you.
Thank you. That ends public comment.
Okay, are there any comments or questions? Okay.
Yeah, well, first of all, thank you for the report and for the encouraging news about the number of days from application to admission and also the increased census. I think that's really laudable. You did answer a question I had about reasons for denials. And, I submitted some questions in advance and it's so well done. So I wonder if just for the minutes, you could elaborate on what was written here, because it does explain, the various groups and the reasons for denial, which I think were reflected in some of the things you said, but I think it's helpful just from the point of view of the public. And I would agree that having some information about out-of-county discharge would be helpful as well.
Yeah, one, I just want to add, as we continue to meet with our external partners, like a couple of weeks ago, we hosted some groups from Sutter system as well. One thing we realized, a lot of these, there's a disconnect. And some of that is what kind of patients can Laguna Honda admit? I guess it may come from what was happening in the past, perhaps. And a lot of these questions that we're getting, they kind of seem to be centered around a lot of patients that may be in a hospital that may need housing, not necessarily skilled nursing facility level of care, whether it's custodial. So I think some of these denials are based on the patients that we're getting, or they're too independent for skilled nursing facility, right? Those are the ones that we're categorizing as they don't meet the criteria for skilled nursing level, because they could be appropriately housed whether in an RCFE or an independent living facility with wraparound services. So a lot of the denials, especially priority 4 and priority 5 groups, are because they're too independent and may not meet the criteria to come to Laguna Honda. And then we're also seeing some, obviously, as we had opened up, a lot of these hospitals had a lot of residents who've been there for quite some time that nobody wants to accept. So in the beginning, we saw a lot of referrals where these were patients who were either behaviorally or medically complex, where they weren't able to discharge them. So we were getting a lot of these applications in the beginning from different hospitals, even our within network as well, where these patients weren't really appropriate. Even for us as well. So the denial rate was higher. So they were either too behaviorally complex for us to manage. But as we are moving through this process and we're really working closely with all these partners, they're really understanding the type of admissions we can manage. And that's really where we're seeing the denial rate is going down, because they're really getting what kind of patients we can manage and what our expectations are when they're submitting the applications.
Thank you. Are there any St. Anne's residents that you've had to deny admission?
I believe we may have denied one, because this, like I said, we are also getting some of the referrals which are coming from an RCFE. And we are really looking at to see if those residents would qualify for a custodial level of care, because they are being housed in a lower level of care than a SNF level of care. So there may be some denial in the future. I don't have the numbers, but I can find out. I believe we may have denied one so far, but I know the family was appealing and we were looking into it again. But we can get you more info.
And then, my last question is, when you do have a denial, and after all, these are San Franciscans, what are we doing to try to help them find a place that's suitable for them? I mean, you've got one set of people, obviously, who don't qualify, who are more independent and don't qualify for a SNF, but then you've got these behaviorally complex individuals. What role do we play in trying to help these families find other options for their loved ones?
I think that may be a network question, perhaps, because we want to make sure we admit somebody who's, appropriate for Laguna Honda, at least. Thank you.
Thanks, Diltar, and thank you for that question. So as you know, several years ago, with the decertification of Laguna Honda, we established a joint city discharge group that includes DPH of the network, but also more importantly, the placement team, which is based in behavioral health, but has access and the budget for all those lower level of care, RCFE, LSAT, LOC, subacute. And so we still meet with HSA and HSH to review options for residents who don't meet the level of care for Laguna.
So these people are automatically referred to the organizations that then will take it from there, so that
Yes.
we do our best to find placement.
Yeah.
Great. Wonderful. Thanks for reiterating that. I think it's important. Thank you.
And I also want to, acknowledge the increased pace of admissions and the increase in the census. I hope that some of the initial issues that you have just articulated in terms of the reasons for denial or some of the coordination in education that's happening continues, so that these numbers will, which look really good, at least for the last 2 weeks, will continue. I had a question about the waiver application. So you indicated that it's an uphill, it may be an uphill battle. Is there more detail that you could provide in terms of some of the feedback that was received from CMS and what we're doing to address that?
Yeah, so under the regulatory standards for the waiver to be approved, there's 2 criterias. One, that it doesn't adversely affect the care of the residents that's at Laguna Honda. And then second is that it meets their special needs. And that's a justification that's really hard. That's the bar that's really high. The feedback that we have gotten from CMS, how do you justify that adding a 3rd bedroom to a 2-bedroom will serve the special needs of the residents at Laguna Honda? So it is an uphill battle, given making that case is very tough. I mean, the regulations are designed for a reason, right? So we are trying to make an argument that it's really going to help the population that we have that's currently at Laguna Honda. They were very clear that this has nothing to do with whether community has needs of beds. It's solely based on the population that's at Laguna Honda currently.
And is that the same response or communication that we're receiving from the state as we try to work with them on the waiver as well?
So there is stipulation in the regulations. If there is a denial from CMS, then we might be able to work with the state for a waiver that would apply to nursing facility. So CMS calls the regulation, under the regulations, they'll call it skilled nursing facility because we are Medicare certified. And then under the state regulations, it's a Medicaid certification, so they'll call it nursing facility. So there may be a pathway with the state. If we were to get a denial from a CMS, then we would work with the state to see if they would be willing to provide a waiver, which within the regulations, they do have the authority to certify those beds maybe as a Medicaid beds only. So they wouldn't be dual certified, given that state only has authority whether they could approve the Medicaid waiver for those beds. So that would be another path that we would have to explore if CMS were to deny the waiver.
So would we have to wait for a denial from CMS then before we can make that appeal to the state? or is that something we work on concurrently?
We would have to wait before we pursue that avenue before, and we hear back from CMS what their decision is.
Okay, thank you. Any other comments? Okay.
Move on to the next slide.
Yeah,
Thank you.
I think though that, Mark, you had said that Dr. Tai wanted to address generally, I guess,
Thank you. I was running over here, so I didn't get to do it at the beginning. Thank you, Diltar, for that. Because this is now my second week in this role, and this is my first Laguna Honda commission meeting. So I just wanted to say at the outset, one, how important this work is. Even in my first week with the network, with Diltar, with the team, we've already had several meetings going through all the details of Laguna Honda. Priority number one is to make sure at the highest levels we have safe, quality care for everybody that we serve at Laguna Honda. And obviously, part and parcel with that is making sure that we are able to maintain our CMS certification for all the reasons that the public in this group have discussed. And so the team knows they priority 1, 2, 3, 4 is to keep their eye on the ball on that. The mock surveys that we will discuss later with HSAG and others are very helpful. Running a ton of drills, making sure there's consistent clinical education of frontline staff, all of that incredibly important. So I'm sure you've all been briefed on many of those pieces in the past, but I wanted to reiterate how important that is and that we don't take our eye on the ball. Off the ball on that piece. So that's number one. Second, which Diltar talked through, and there's been much comment on our census. We want to get back up to census. That is a huge operational priority. We were not where we needed to be on a number of dimensions, including the time between getting a referral and actually being able to admit folks. You've seen the work that the team has done has really paid off in terms of dramatically reducing that time frame. We want that sort of work to continue. And I think as Diltar and the team noted, the team is out there with hospitals and other places of referrals in the city to make sure that everyone, including individual case managers, are aware that Laguna Honda, we have beds open. We are able to help meet some of the skilled nursing needs of San Franciscans and to get more of the referral pipeline in, which will be incredibly important for that. So I wanted to note that. And third, we're going to be doing everything in our power to make sure that we can have not just a full facility, but that the 120 beds that we ideally want to have all of those on our, not just our license, but to be able to staff and fill those. And so we'll be doing everything in the toolkit to advocate and push to, when Diltar mentioned there will be an uphill battle, we're noting that up front, but we're going to do everything in our power to try to retain those 120 beds for San Francisco. So I just wanted to say that at the outset. And thank you.
Thank you. I appreciate you addressing and being clear about what those priorities are so that it helps us on the JCC really align what we're monitoring and what we're sort of agendizing, I guess, on during the meetings to align with that. And I appreciate also that at the second week that you've immersed yourself. So it seems pretty fully on the most critical issues, I think, that have been of the concern of both the public as well as here on the committee and on the commission. So appreciate that.
Thank you.
I just wanted to share a couple more details on the admissions. One, I want to thank Dan. He's been very supportive, and thank you, Dan, and articulated really well what the priority is. And I also want to congratulate the team. They have done a phenomenal job in really ramping up the admissions. But now we're also working on making sure that we continue to communicate with our community partners. We really have to show the quality of care that we are providing. There's such a negative publicity out there when we're talking to these different partners and the perception they have about Laguna Honda. It's such a nice facility. I mean, I came from a private world where skilled nursing facility doesn't offer a lot of the services that we have. I mean, we have state-of-the-art facility that we got to highlight and really show to the public. Last week, we had a team that was filming the facility so we could have a video tour on the website where somebody sitting in their hospital bed can look at the facility to see what it looks like. And the reaction that we have gotten when we had these visits from different case managers is, wow, I mean, what a nice facility, right? Who wouldn't want to come there? And I'm proud of the quality of care that we provide to the residents. So we're really working on making sure we're really highlighting Laguna Honda, continue to work on making sure that we have marketing material that we could share with these partners, where Albert and I will, later in the next few weeks, we will really be going out to the community partners and sharing this information with them to really market Laguna Honda so we can continue to build the referral source and work towards, as we improve the admission space, that we really work on building the census while we continue to make sure that we stay compliant with the regulations and putting the resident safety and quality of care at the forefront.
That's really good to hear. And I'm glad that, in fact, the push for the renewal of the admissions necessitates this community outreach and allows for, I guess, sort of a new sort of set of approaches and eyes and tactics in order to do that. And so it's sort of timely in that sense that the reputation of Laguna Honda gets a sort of a second sort of unveiling, I guess, or a new unveiling during this time. So appreciate that and look forward to hearing more about how that is going. I actually would like to see the video, or if we could link that to members of the commission or the committee when it's done. That would be great.
Thank you.
Right. Shall we move on, Commissioner? Vice President? Thank you.
Thank you.
We can move on to the hiring and vacancy report, item 5.
Good afternoon, Commissioners, and good afternoon, Director Sai. I'm pleased to present the Laguna staffing report for the month of March. Laguna vacancies stand at 0.05%. Please note that HR data and reporting is aligning all its reporting with the finance methodology of applying attrition savings when reporting on vacancies. So beginning this month, the report is generated from a single data source, and the vacancy rates include the authorized vacancies based on the annual salary ordinance and with attrition savings. Attrition savings is nothing but the allowance for turnover, an estimate of funding that will not be used because positions will not be filled all year. We hired a total of 13 new hires in February, and which includes 8 new hires, 3 transfers, and 2 rehires. We also saw 5 separations for the same period, all of them being retirements. 2320, or the registered nurse classification, is exempt from the current hiring pass, and the HR team is continuing to support with filling the vacancies we have at Laguna. The vacancy rate for this class currently stands at 1.6%, which is no change from what we saw last month. We hired 2 registered nurses last month. The HR team continues to hold planning meetings with exec leaders at Laguna and hiring managers on a weekly, monthly basis to go over vacancy information and hiring plans. Registered nurse highlights: 2 registered nurses started in February. As for non-RN highlights, we saw 5 2303s or patient care assistants who started in February, and 1 2312 classification or the licensed vocational nurse who started in January. Thank you.
Thank you, Priya. Is there any public comment?
Is there any public comment in the room on this item? Right, there is a hand up from our remote. Actually, there's two. Dr. Palmer, you've got 3 minutes.
Hi, this is Dr. Palmer. The arbitrariness of some of these positions frozen to save payroll, it seems like will endanger patient care and cost more in the long run. For instance, shortages in clerks or even a morgue attendant will pull direct care staff from the bedside. There's a freeze on psychologists, and this will lead for poor care for behavioral issues. Lack of a radiology technician will lead to time-consuming and labor-intensive ambulance trips across town for x-rays. The risk of poor care and decertification then rises. Does the mayor and the board of supervisors and the big bosses who are deciding priorities, are they educated about the consequences of past mistakes in regard for this? I'm really worried that about being penny wise and pound foolish. Thank you.
Thank you. Mr. Manette-Shaw, you've got 3 minutes. Mr. Manette-Shaw, are you there? I'll give you to 3. Okay, so I will thank you. You can always submit a written comment. That ends public comment for this item.
Thank you. Is there any committee member comment? Yes.
Yeah, well, thank you for the report. I wonder if you could elaborate a little bit and help us better understand the frozen positions, because as I looked at some of them, I had some of the thoughts that Dr. Palmer did raise, and I'm wondering if you can help explain some of those things. I mean, I know that we did not diminish staffing even as our census fell, so perhaps there's some of that there, but when, like, there's one morgue attendant position and it's frozen and things like that, I'm just wondering if you can help us better understand if you feel there are any frozen positions that could put patient care at risk, or some that you'd like to lobby to have filled.
I was going to ask if that's a question for Priya or for Diltar. Yeah.
Thank you for that question, Commissioner. I'll address that. One, I just want to assure that even though the positions are frozen, we continue to work on making sure that we're moving through the process until we can really identify a candidate that's appropriate for that position. And then we've been given the direction to, we're working with the mayor's office through our finance department, and putting together a list of positions on a monthly basis that are crucial to the operations and submitting for those approval on a monthly basis. First round in February, for example, for Laguna Honda, we had submitted 10 positions, 9 were approved, and then we continue to work on moving forward with hiring those. So there is a process in place being utilized, so that way it's not impacting the operations.
It would be wonderful if you could share with us a little bit of the timeline, maybe what positions you're pointing out is really critical, and then what the process is and the timeline is to be able to get those positions first unfrozen and then filled. I mean, I know we're so much better than we used to be in terms of the speed with which positions can be filled. It isn't the 266 days or whatever it used to be, but it'd be really helpful to understand your analysis of your priorities in terms of which you would want to get filled, and how we can be supportive.
Obviously, any patients which are directly impacting the patient care, but also, as you know, it takes some time in the hiring process. So we want to make sure that we're prioritizing positions which may be closer to where we can hire somebody much faster. Like if we have a position where we have identified a candidate and we can bring them very soon, versus where we may still be waiting for an eligible list, and it could take a few weeks before we could move through the process. So they may both be important to the operations, but we're prioritizing the ones where we can move quickly and have the most impact to resident safety and care.
Thank you.
So it seems like there's a balancing act that you're probably constantly having to do between not losing candidates that are filling important positions and identifying those that are a little bit further off, but need more that need more time for recruitment or processing, but are also critical, particularly to patient care.
Yeah,
Is that correct?
and I believe Roland can probably comment more. There is a finance team is also working with mayor's office, and I believe directly, I think there's 100+ categories of, you want to?
Sure. Thanks, Diltar. So yes, Diltar is correct. Our CFO, Drew Morrell, and Luena Kim are actually the leads working on behalf of DPH with the mayor's office for further clarification of which positions are a priority and which ones need to be released. So they are the point of contact, and then they get information back to the network and PhD, and then us to our divisions like Laguna Honda and Zuckerberg. So it's all funneling up through the CFO and director of HR. But the mayor's office has been very complimentary of the process that DPH has used. And we saw that in the fact that DPH got more of its positions percentage-wise approved than any other city department in this first go-round during the freeze.
Thank you for that explanation. I think it's an important thing for us to keep a handle on, and compliments on getting a compliment from the mayor's office on the process. I did have another question for Priya. Could you explain a little bit more what this means about the finance methodology of applying attrition savings when reporting
Sure.
on vacancies? I don't know what that is.
Sure. So in very simple terms, that means that when a position is vacated by an incumbent, so there's someone in that position, the position is vacated, and that position is vacant for a set number of days, months. And what that really means is that that position is not filled for the entire year. So from a finance perspective, that's attrition savings. So that's also taken into account when you're looking at vacancies and the vacancy numbers to reflect the true vacancy rate for any given facility.
Okay, thank you very much. Appreciate that. Okay, no other questions?
All right, thank you. We will move on to item 6, the regulatory affairs report.
Good evening.
Geraldine? Yeah.
My name is Geraldine Mariano. I'm the Director of Regulatory Affairs. I will present the end of January and February 2025 Regulatory Affairs Report. From January 26 to 31st, 2025, Laguna Honda had additional 8 cases in which there were 4 facility-reported incidents that were reported to CDPH and 4 anonymous complaints that were investigated by CDPH. CDPH completed their investigation for the 2 anonymous complaints for January 2025 with no deficiency for both anonymous complaints. In February 2025, Laguna Honda had 6 facility-reported incidents to CDPH and no anonymous complaint received from CDPH. There were 3 CDPH surveyors did an on-site visit on February 27, 2025 for our General Acute Care Hospital change of services request to add 4 services to our acute license. Good news, as of March 4, 2025, CDPH issued a memo as an interim initial license for the facility that we can provide services for the outpatient service pulmonary clinic, for social services, for respiratory services, and rehab services in our Laguna Honda General Acute Care license. The facility did not receive any 2567 statement of deficiency from CDPH for the month of February 2025. Currently, we have 33 facility reported incidents that have not been investigated by CDPH. Please let me know if there's any questions or comment that I can address at this time. Thank you.
Thank you, Geraldine. Is there public comment?
Is there any public comment on this item in the room? I don't see any, but I do see a hand. Dr. Palmer, you've got 3 minutes.
I'm sorry, I had no comment. I'll unmute
Okay,
myself.
no problem. No public comment on these items. On this
Any
item.
questions? None? Okay, thank you. We can move on.
All right. Item 7 is Laguna Honda Hospital policies.
Good evening, Commissioners. My name is Carmen Trin. I'll be presenting the policy and procedures for approval today. In front of you, there are 6 policy and procedures, 2 hospital-wide and 4 departmental policies. I will verbally go over the 4 additional questions received later in the afternoon. The first one being 72-01, the last paragraph, last sentence, the last word overtime should be overtime. That was fixed. Next question on page 8 of 19 of the same policy, unique hand hygiene situations, please define IPC, which we did. We put infection prevention and control. The next one is page 10 out of 19, also same policy 72-01. Please clarify hand hygiene requirements begin now. That was corrected to just hand hygiene requirements. And finally, for D1 2.1 attachment, the nurse call system. It says that it was very complicated, and has there been any comment or whether these illustrations and directions were helpful? From our Department of Education, they said they have not received any feedback on whether the illustrations and directions were helpful, but the images are helpful to reinforce the written instructions. This policy is covered by the clinic liaison group, and they can provide more insight. I'm happy to take additional questions or any comments.
Thank you, Carmen. Is there public comment?
Any public comment on this item in the room? All right, no, I don't see any. I don't see any hands, so there's no public comment.
Any additional comments? Okay. Again, thank you for timely responses to the questions that have been posed by members of the committee.
Commissioners, please consider a motion.
Okay.
I move that we submit these policies and procedures for approval by the entire Health Commission.
Second.
All those in favor?
Aye.
Aye.
All right, thank you so much. Item 8 is a consideration for a closed session.
Okay, is there a motion?
Move to go into closed session.
Second. All those in favor?
Aye.
Aye.
All right, please give me a few minutes or 30 seconds to take us out. Folks who are members of the public, you will not see or hear us while we're in closed session, but we will be back after the meeting. Thank you so much for attending. And we are back in open session. I want to apologize for not calling for public comment during the open session. And we, of course, will take written public comment for anyone who would like to make comment on that item. But that was my error. And again, I apologize. It was not intentional. Commissioners, you approved the PIPS minutes and the credentials report. Would you please consider a motion to disclose or not disclose other discussions held in closed session?
Move not to disclose.
Second.
All those in favor?
Aye.
Aye.
And then please consider a motion to adjourn.
Move to adjourn.
Second.
All those in favor?
Aye.
Great. Please give me 30 seconds to take us down. Thank you, everyone, for attending today and those of you watching.